I'm Dr. Nicole Anderson, and welcome to this installment of Hacks to Stop Back Attacks. So, your knee pain could be coming from your back. What? So, actually, knee pain right in this area right here, or right here, or even deep inside the joint, very often it's coming from the lower back. We treat several people per week with this issue because it's commonly missed. You could even have a meniscus tear that's been diagnosed and confirmed, diagnosed by a physician, confirmed on an MRI, that could be asymptomatic, meaning that you're not having any symptoms or any problems. It could be if you addressed the problem with your back. And that's something that we specialize in here. So let me explain a little bit more about how that happens. So, one of the things that happens with knee pain is if you don't have enough stability to support the knee joint, then what happens is the joint, it's all sloppy, okay? And then that causes rubbing, which causes pain. So any kind of little meniscus issue that you have in your knee already is going to become symptomatic. But if you can stabilize that knee joint, then the meniscus, even if there's a tiny little tear in there, or even if there's a big tear, that meniscus could be asymptomatic. So the key point is to stabilize the knee. So even if you've had physical therapy in the past and it temporarily made your knee pain get better and then the knee pain seemed to come back, it might not be the meniscus. So don't rush off to get another surgery, and don't go back to physical therapy focusing on your knee. You might want to have a specialist look at your back, because what can happen is specifically the femoral nerve, which comes out of a branch in your lower back. If there's impingement, meaning that there's a restriction on that nerve, there could be soft tissue compressing on it. It could be coming from actually a disc issue, or it could be coming from a narrowing right at that nerve root. So if you're having any of those kinds of issues, then what can happen is that femoral nerve isn't getting a good enough impulse to the muscles that stabilize your hip and your thigh. And so what we do here is we actually decompress that line without surgery, without injections, without pills. We decompress that line of fascia, we decompress right around the nerve root using multiple different techniques, and we stimulate the nerve using specialized types of electrical stimulation, which we're actually the only clinic in Orange County at the time of this video that does this kind of electrical stimulation. And with that combination of care, we get your hip and your leg stable so that your knee stops hurting. So if you're having knee pain, if you're having issues with your meniscus, it could be that it's not even your meniscus. It could be that it's a problem coming from your back. And so contact us. We'd be happy to do an assessment, figure out if that's what's going on with you, and give you a suggestion of what you can do about it.